So for the female, from the exterior first, we can see from the superior, we're going to have the skin-covered labia majora folds, the inner redder and more mucus-type tissue-covered labia minora. Now, up here around 13 would be the clitoris. Then we'd have another opening, which we can't quite see here, the urethra, and then we'd have the vagina. And then down here, we'd have the anus. Now, this area between the labia minora and with the clitoris on the superior and the vagina on the inferior, that whole area is called the vestibule. And under that vestibule, under the labia minora, is going to be some vestibular glands to moisten that area. So get those orders down. Vestibule, clitoris, urethra, vagina, and then rectum. Now we'll look at a side view here in a minute, but let's go ahead and move to this. Well, let's look at this side view now while we have it here. Okay. Now, I just took that apart there and took the front off. Let's get it oriented like this. Okay. From the side, I'll put this back on. There. Okay. So I'm just taking the right side off. Here. Put that back on. Okay. Here. Now here, 8, we can see the labia majora. 7, labia minora. Here, 11 is the clitoris. You can see that the clitoris also has a root, just like the penis. And it has a little glans part there. Remember, we said same number of nerve endings on the clitoris as the penis. They're just all concentrated. We have some erectile tissue in the clitoris, just like the penis. And we have the large root. This mound of fat here on top of the pubic bone would be called the mons mound pubis on the pubic bone. What else we see here, of course, this would be the vestibule between this labia minora and the one on top of it, which we removed. The other things we can see here from the side, and I'm going to go ahead and just put this back on so we can get that perspective again. Here, part of that uterus we took off. Let's put that back on. Okay, it's fun. So here, looking down into the pelvic cavity, remember, this is not the bladder. That is the uterus. We can tell also because, remember, we have the ovaries here leading to the fimbriae fingers, leading to the fallopian tube, also called the uterine tube, which leads to the uterus. And the same on this side. Ovary, fimbriae, pulling the ovulated egg in, fallopian tube or uterine tube. Of course, that's the colon back there. And this is actually going to be where the bladder would be. But let's go ahead and take this top of this uterus off. Okay. Now we can see some layers of the uterus. The endometrium, lining, myometrium, muscle layer, parametrium, covering it. Now, coming down here, this area of the uterus, actually it has a hump on it, is the fundus region. Then we have the body region, and the cervix is going to stick down into the vagina. So now I'm going to take this apart. Thank goodness it's magnetic. So here, we can see the ovary nice now, over 4. Fimbriae, fallopian tube leading to the uterus. Now the three parts of the uterus, since the fallopian tube's coming in here, right here, this is the fundus, this is the body, and now we can see the cervix part sticking down here. This little hump here into the vagina. Now the vagina has rugae on it, just like the bladder had rugae. And again, that's mainly for expansion, but also it's going to give some sensation there too in the vagina. Of course, their bladder is not only inferior to the uterus, but anterior to it, and it has its separate urethra. Rectum back here. Order again in the vestibule. Clitoris, urethra, vagina, rectum. All right, here's another sagittal view, another model. So here, mons pubis, the pubic bone. Here we have the clitoris. This would be labia minora now. And there's another labia minora. So the vestibule would be this region in between here. Labia majora, you can see one of them here. These are the vestibular glands because they took off part of this labia minora, and you can see the large vestibular gland. Urethra is going to be about there, and then the vagina here, rectum there. From the side again, ovary, 15, fimbriae, point in the ovulated egg, fallopian tube or uterine tube, leading to the uterus. Now we can see some of the three ligaments we want to learn here. This big broad one in the background holding everything together, the ovary, fallopian tube, even the uterus, called a broad ligament, this whole area. Then we also have a uterine ligament here that's going to connect the uterus to the ovary. Right there. Looks like it's 76. Uterine ligament. Actually, that's the ovarian ligament. The ovarian ligament. The round ligament is this one that holds the uterus in place. It goes from the uterus, 17, to the body wall. Also the uterus in place. So we've got broad ligament holding everything, round ligament holding the uterus in place, and this ovarian ligament holding the ovary to the uterus. You can see the ureter come down. All right, now here, you see the uterus, fundus, body. There's going to be the vagina here. Can't see the cervix yet. This is the bladder. Take it off. Okay. Now, you can see the fundus, body, the uterus, and here's the cervix. So, just like the male has the prostate exam, the female has to get the pap smear once in a while. So they stick a little tube and a little clipper up into the vagina and just take a little snippet of the cervix here, and that's your pap smear. Check for cervical cancer or precancer. Cervix dips down into the vagina. Here we see the bladder, urethra. Now we can see the root of the clitoris and the head of the clitoris, and the body. Labia minora, labia majora. See the 3 layers of the uterus? Endometrium, myometrium, parametrium. I'll point out the ligaments once again, make sure I get them right. Ovary, fimbriae, fallopian tube. So that would be the ovarian ligament, round ligament, broad ligament. Okay, now we have another side view. Okay. So side view here. Looks like we have lines of pubis, pubic bone, clitoris with the 3 parts, 5 labia minora, 6 labia majora, urethra, bladder, vagina. So this is the vestibule. Here, ovary, fimbriae, fallopian tube, uterus, fundus part of the uterus, body part of the uterus, cervix part of the uterus, vagina with rugae, vaginal opening, 3 layers uterus, endometrium, myometrium, parametrium. We got the ligaments. Ovarian ligament, holding uterus to ovary. Round ligament, holding uterus to the body wall. And this broad ligament, holding everything together. All right, let's just show you one more thing here. This would be the uterus with a child. This is in the 2nd month. Just to show you ovary, fimbriae, fallopian tube, uterus with the child starting to grow. There. Of course, we're still surrounded by endometrium. It's embedded in there. Myometrium. And we can see that the cervix is coming through here into the vagina. See the rugae here at the beginning of the vagina. So when they talk about cervical dilation, they're talking about, you know, to tell when the baby's ready to be born. It'd be that area there. Here's a big model of that. When the head's ready to push out the cervix here, right here, it will dilate the opening. They can tell when the birth is imminent, depending on the dilation, of course. On this uterus, you can see the ovary and fimbriae and fallopian tube still there.